Thank you very much. So before we conclude this part of the press conference, and before I give the floor back to Tamer from ACANU and to Dr. Tedros for closing remarks, I would just like to invite our guest, Dr. Sarah Miller from Refugees International, to say a few words.
Thank you so much. I should emphasize, I'm not a medical doctor. My doctorate's in international relations. So take that as you will in the community. I appreciate you giving me a few minutes to share some of what I learned on visiting Tigray, Ethiopia last month. Refugees International does research and advocacy, and we focus on displaced persons, of course. So I was able to spend some time with IDPs, internally displaced persons, and was frankly very alarmed at what I had witnessed and what I was hearing from health professionals and IDPs themselves. As noted in the conversation around gender-based violence, is widespread. And while the numbers, I should emphasize the BMJ numbers, to clarify, of the approximately 82% raped, that was of sexual violence survivors, which is of course a smaller number. So it's important to emphasize the data. But note that that's really just a starting point. The numbers are, frankly, as other colleagues have emphasized, they're much higher because it's not often reported. And so frankly, the sexual violence from the conflict and still ongoing is very widespread, very concerning. To be quite blunt, I was shocked at the lack of response. I've traveled in many conflict and post-conflict settings, and usually there's an array of international actors, of active NGOs. Local officials and NGOs are doing some excellent work, and there are some fantastic professionals, but quite frankly, there was this sense of where is everyone?
Hyping her girl.
So I really hope we can see some scale up and some difficult questions asked on where the international community is in Tigray. Many of the women are still facing a range of physical and mental effects of gender-based violence and sexual violence in particular. Of course, the reports that have come out, and certainly from our interviews and field work, indicate that many women have had very little support. Recall that the health infrastructure was very impacted. Many clinics, many sites were destroyed or are very damaged. And so it's very difficult for people to obtain any kind of support. We will be focusing a lot of advocacy on mental health. Many women have had very little access to mental health. They've now born infants, and some are now toddlers from some of these attacks, and they've had very little support. It's compounded by the lack of food. Hunger is widespread. The U.S. government has finally restarted its food assistance, and it should be ramping up. But many people that I met with women who were feeding their children, kind of a hardened root that is reserved for cattle feed. So it was pretty severe. And so to try to recover from both the mental and physical effects of sexual violence amidst those conditions was pretty staggering, I had to say. I would also emphasize that shelter remains a key issue, and that the conditions in many of the schools that IDPs are huddling in are still pretty bad. Health officials in Tigray were emphasizing communicable diseases were spreading. They were seeing cholera on the rise. And so I can refer you to those health experts who can speak more specifically to that data. But functioning latrines were hard to come by in many of the IDP settlements that I visited. And so there were a range of indicators that it's a very dire situation. I would also emphasize that peace is fragile at best. And so the scale up of humanitarian assistance, including mental and physical health assistance, will have an effect on how well the peace holds as well. Some of the very specific things that were cited to me, of course, fistula repair, and then of course lots of different services that are still very much lacking. Many women are still struggling to access any kind of appointments and whatnot. I heard other colleagues on this call mention also, of course, the effects of climate change as well. And so there's a lot of different issues that are impacting this region. And I really hope that we can see a scale up and support in the coming year that will help improve the response in this region, because it really is dire. And I appreciate you all giving me a few minutes to emphasize that. Thank you so much.
Thank you very much.